Good afternoon, and thank you for joining me for another Leadership Rounds. I'm Dr. Mindy Estes, President and CEO of the St. Luke's Health System in Kansas City and Board Chair of the American Hospital Association. This week, I'm pleased to introduce Dr. Kimberlydawn Wisdom, Senior Vice President of Community Health and Equity and Chief Wellness and Diversity Officer at the Henry Ford Health System in Detroit, Michigan. A board-certified emergency medicine physician, Dr. Wisdom also serves as Michigan's and the nation's first state-level Surgeon General. She provides strong leadership in areas of health disparities, health care equity, and population health, as she strives to improve the health of those disproportionately affected by poor health outcomes. Since 2007, Dr. Wisdom has been a part of the Henry Ford system, one of the nation's leading comprehensive integrated health systems, providing both health insurance and health care delivery. With 6 hospitals, dozens of medical centers, and more than 30,000 employees, Henry Ford is committed to improving the health and wellness of its diverse Michigan community, but also serving as one of the region's largest and most diverse employers. So Kimberlydawn, thank you so much again for joining us.
I'm delighted to be here with you, Dr. Estes.
So let's just jump right into it. We all know that given the current socioeconomic and political climate, we're in for an intense seismic shift in our country and in our field. But that shift is really only part of a larger and longer journey for racial and social justice, where we'll continually learn and grow. But now, from where we are today, how do you see us beginning this journey? Where do we start?
Well, for one, you captured it very well by saying it is a journey. And what's important when you embark upon a journey, wherever you are in that journey, is to know where you are at any given time, where you want to go, where you want to be, and also recognizing the barriers that may exist, as well as any of the things that may be facilitators on that journey. We all don't start at the same place related to our equity work or our diversity and inclusion work. We're all in different places, so you need to recognize that, sort of one size doesn't fit all in terms of embarking upon the journey. So what we have done at Henry Ford Health System when we began our journey around equity and inclusion was we did an assessment. We had an effort where we would reflect and identify ways to empower people. And then we ultimately had clear action steps. And we actually used a scale called the area scale, assessment, reflection, empowerment, and action that helped us guide our journey. So we knew exactly where we wanted to be, and we understood the barriers that may exist. So even in today's environment, it's important to understand that people need to understand history. They need to be obtain various kinds of cultural competency, education, and also to understand what can be some of those facilitating factors. And what's beautiful in terms of the place that we are now, although we've seen, tremendous social injustice, civil unrest, I'm not, of course, speaking about that. But what's very helpful now is that many organizations have been on this journey for over a decade, which means that we can provide support, coaching to other entities, and they don't have to perhaps even make the same mistakes that we made, that they can actually build upon the efforts that have already been in existence, the best practices, and that can help accelerate their journey. So knowing where you are, where you want to go, and of course, leverage those people that have been along the journey a little longer than you have.
It really is true for so many things, standing on the shoulders from those who've gone before and recognizing that we're not alone in this journey. I appreciate those thoughts. During this COVID-19 crisis, the health of our diverse communities is more crucial than ever. Can you share any examples of how you've responded to your community's needs as it relates to COVID?
Absolutely. Well, in part because we had been along on this journey for some time, we took spent a lot of time being as responsive as quickly as possible. Sometimes people refer to that as being shovel ready. So we were ready to respond to the community as quickly as possible. So, for instance, when you look at social determinants of health or addressing social need, we had many communities that we had already provided food to in the past, or cooking classes, or ways to engage them around addressing food insecurity. So we accelerated those programs. We also accelerated programs working with our pregnant moms who are underserved and may be at risk for experiencing infant mortality or infant death in that first year of life. So we accelerated those programs, getting services and blood pressure cuffs and Dopplers to those individuals. We also connected very much in terms of providing COVID testing in places that are non-traditional, and we collaborated with our health department to do that. We provided PPE where needed. And even during the protests that were occurring, we provided the ability to, we distributed over 4,000 masks and that sort of thing. So between, and also lastly, I do want to mention in terms of addressing social need, we piloted an effort around recuperative housing to get people out of the
Mm.
hospital quickly and into a stable housing environment if they were not able to return to their home setting in a safe manner. So we provided many efforts, but I think what was key is that we did them quickly because we were shovel ready in many respects, and we also identified innovative things that we could be involved in, and were able to receive some grant funding in that respect.
So, building on that, as we move into the fall and prepare, I guess we are in the fall, and prepare to continue battling both COVID and now the flu, how will Henry Ford communicate with minority communities for whom these health disparities may be even further exacerbated, and where I think there is some concern about vaccine availability and whether, in fact, they should take the vaccines?
Yes. So we engaged our network of community members around our the Detroit metropolitan area. Actually, our footprint, Henry Ford's footprint, is in 4 counties. So we have over 200 community partners in among those 4 counties. So we engage them, and we've been engaging them over probably the last 20 years.
Mhm.
So that those partnerships were very important. So whether it's our faith-based leaders who are very trusted partners that we reached out to, um, we engaged our some of our team members who we had trained around equity, our healthcare equity scholars. So we had about 40 people that have been trained, and they've gone through a significant immersion experience in that respect. So we have and other community-based partners. So we engage those partners in order to help us facilitate efforts related to COVID-19 and accelerating those efforts.
So, during COVID, we've talked a lot about resilience of our staffs, but obviously it can extend beyond the COVID pandemic. Uh, what advice would you give healthcare leaders? What should we be doing for our teams and communities around issues of diversity and race, particularly now that our nation is really managing in a time of such unfortunate division and unrest?
There's no question this is a time in our history like we've never seen it before. In light of so much that we know and also so much that we're experiencing. So, one element is for one to provide support as much as possible and to have conversation. Now, about 3 years ago, Henry Ford Health System, we started a storytelling project, and it was about how to have difficult conversations about race and to become comfortable having those difficult conversations. So, one thing that we've embarked upon is to have conversation, have open dialogue where team members where they can converse and talk about how they're feeling, talk about what they're experiencing, and in a very safe environment where people don't have to feel like they're judged or will be criticized or be made to feel at all guilty or shameful in any way. It's very much about calling people in and not calling people out in terms of we know some of the things that have happened are, you know, just yeah, outrageously unfortunate. However, we have to work together in order to heal our communities, to heal the nation. So, having those difficult conversations is very important. Also, providing resources. We have recovery and heal resources to help support our team members so they know that they can have access to those type of resources. We have our employee assistance program where people on an individual level or as a group can go and receive support during that time. Also, educational experiences are important. So we offer a plethora on our Henry Ford University, a plethora of resources such as unconscious bias education, cultural competence training, and we're populating that with more and more resources. Also, we've engaged our employee resource groups. We have 10 employee resource groups,
Mm.
which are affinity groups representing various entities, and we've engaged them. So, whether they're racial and ethnic, like African American, Latino, Arab American, or some of our ERGs address those affected by disabilities, or veterans, or women. So, we have engaged them in very specific ways. And also, we try to continue to communicate through newsletters and other mechanisms. But what's important is we're trying to build a inclusive, trusting, safe environment where people can feel that they can be supported, they can learn, they can grow, and we can be on this journey together and certainly serve our employees well, but also ultimately serve our communities well.
Well, as you say, listening is the key to building trust. Um, how important is it for hospitals and health systems to engage the public and other community stakeholders around issues of health equity? And what role can hospitals and health systems play?
Well, hospitals and health systems can play a key and major role. They are seen as a trusted place in most settings. Now we know there are communities, particularly African American communities, that may not have a history of full trust of healthcare and healthcare systems, but by and large, it's a place where tremendous leadership can be exhibited because it is a place where people go when they are most vulnerable.
Mhm.
So, so in that role and having that responsibility of addressing people's needs when they are at some of the most challenging times of their life, we can play a significant role. We can play a significant role in offering programming such as food distribution programs, such as education programs, such as we could alter our practice. So, for instance, around infant mortality, we have a developed group visit model, an innovative model where we have community health workers and certified nurse midwives co-facilitating group visits for women. And we've seen just amazing outcomes in terms of nearly zero preventable infant deaths amongst those groups. So developing practices that support the community and leading in that way and working even with our public health colleagues. We can lead in a way to help shape policy. So we are very supportive of the community health worker model, those natural navigators in the community. So we have about 19 of them at this point. And we work with our team members in Lansing around reimbursement for community health workers. Or we actually even had for our Medicaid rebid, the RFP language was intentionally written into that RFP that for every 20,000 members of your health plan, you had to hire one community health worker. And now that ratio is about 5,000 members per one community health worker.
Wow.
So we work at the policy level as well. And lastly, the way health systems can play a leadership role is to partner. We know that as healthcare entities, we cannot do this work alone. I mean, if we truly want favorable healthcare and health outcomes, we can't do it in a vacuum. It's clear, we know that. So partnerships are very key. So we partner with whether it's our around our housing and recuperative housing centers, or we partner with other entities related to food distribution and providing nutritious food and cooking demonstrations. We partner around transportation. So those partnerships are very, very key if we're going to address social needs in a very robust way. So we can and we are playing a major leadership role. I think that can grow and expand over time while we do understand that high quality care, favorable outcomes, equity are key from our clinical standpoint. We know that there are many other factors and many other partners that are going to help us achieve those ultimate goals.
Well, thank you for that list. It gives us a good opportunity to understand how we are conveners. And I think one of the things that has come from this pandemic is that hospitals are more trusted than ever. So we now clearly have an opportunity to advance health equity. So, Dr. Wisdom, thank you again for sharing your insight on how we best address issues of health equity and ensuring equitable access to care for all Americans. I know your perspective as both a clinician and expert in the area will help many leaders as we continue to navigate the challenges ahead. So until next time, thank you to everyone for joining us today. I hope you'll be back for our next leadership rounds, which will be on October 22nd. Until then, stay safe and be well. Thank you again.
Absolutely delighted to do it. Thank you.